Welcome to The Explainer. Today we are diving deep into a topic that trips up so many students on their exams, rickettsial infections. But don't worry, by the end of this, we're going to flip that script and turn all that confusion into your biggest advantage.
So, have you ever found yourself staring at a list of these diseases, trying to connect all the dots? You know, the similar sounding names, the different vectors, the rashes, it's a classic stumbling block. But the secret is just building a solid framework, and that's exactly what we're going to do right now.
Here's our game plan. We're going to move through 5 clear sections. We'll break this whole complex family of bacteria down into memorable, exam-ready pieces. Trust me, this structure is going to be your key to remembering everything when it counts.
All right, let's jump right into section 1. Look, before we can even think about telling the diseases apart, we have to get a handle on the fundamental properties that link all these organisms together. This is the foundation that makes everything else just click.
Okay, first thing you absolutely have to burn into your memory is this. Rickettsia are obligate intracellular bacteria. What does that mean? It means they are completely dependent on a host cell to replicate. This is a non-negotiable fact, and it's the reason you can't just grow them on a normal petri dish like other bacteria.
So let's lock in these core traits. They are gram-negative, but they don't stain well, which is why we prefer a Gemsa stain. They have a very specific target, the endothelial cells lining our blood vessels, which totally explains the rashes, right? And they all get inside our bodies thanks to an arthropod vector. These are the high-yield basics you just have to know.
And here we have a classic exam trap. Examiners absolutely love to ask about the ones that got kicked out of the family. So remember, Coxiella, the bug that causes Q fever, got the boot because it's not transmitted by an arthropod. And Bartonella, it was excluded because it's not a true obligate intracellular organism. Don't let that question catch you off guard.
And now for the main event. This is the comparison that shows up on exams all the time. If you can nail the differences between the Typhus group and the spotted fever group, you are going to be banking some serious points. Think of this slide as your ultimate cheat sheet. The single biggest clue, the one thing you need to remember, is the rash. Typhus starts on the trunk and spreads outward, almost always sparing the palms and soles. Spotted fever is the total opposite. It famously kicks off on the extremities, like your wrists and ankles, and moves inward. This distinction is absolutely critical.
Need a way to keep the Typhus group straight? Here you go. For endemic typhus, just remember the letters ENT. E for endemic, N for the agent, Rickettsia typhi, and T, well, that's for the vector, which is the flea. It's a super simple way to link all 3 of those key facts together.
And check this one out. It's even easier. For the most famous of the spotted fevers, just think RRR. Rickettsii causes Rocky Mountain spotted fever. Seriously, there's no way you could forget that one. So what's with the 90%? Well, in about 90% of Rocky Mountain spotted fever cases, that classic rash is going to pop up on the extremities, often including the palms of the hands and soles of the feet. When you see that in a clinical scenario, it should be screaming spotted fever group at you.
Now, when it comes to how dangerous these are, one of them really stands out from the pack. Rocky Mountain spotted fever is by far the most fatal of all the rickettsial diseases. While you've got to treat all of them, this is the one you absolutely cannot afford to miss or delay diagnosing. That's a classic most severe or highest mortality type of question.
Okay, so we've covered the 2 big groups, but there are a couple of other key players you absolutely need to have in your arsenal. These are the ones that are often tested as the exceptions to the rules.
Now, Scrub Typhus is kind of the odd one out. First off, it's caused by Orientia tsutsugamushi, which isn't even a Rickettsiae species. And the vector, it's not a tick or a louse, but a chigger, that tiny larval form of a mite. This makes it totally unique. And here is a fantastic mnemonic that is going to save you on exam day. For the Weil-Felix test, just spell scrub with a K, S-K-R-U-B. That K is your mental trigger to remember that it's positive for the OXK antigen and negative for the other 2. This is a guaranteed point score right here.
So when you get a question about a patient from an endemic area, you need to be on the lookout for this classic triad. You're looking for a black, dead-looking ulcer, that's the Eschar, at the bite site, swollen lymph nodes nearby, and then a rash. That combination is a huge clue for Scrub Typhus.
So how do we actually prove what's going on in the lab? This section is all about diagnosis, and we're going to focus on a classic test that, even with its flaws, shows up on exams all the time.
This table right here is pure gold for your exams. Yeah, it's a non-specific test, but you absolutely have to know these patterns. Notice how typhus is strongly positive for OX19,
Spotted fever, it's positive for both OX19 and OX2. And just like we learned, scrub typhus is only positive for OXK.
But here's a distinction that really separates the top students from everyone else. While you get tested on the old-school Weil-Felix reaction, you have to know that the actual modern-day gold standard for diagnosis is the indirect immunofluorescence assay, or IFA. No one for the history books and exams, and the other for real-world medicine.
Whew, we have covered a ton of ground. So now, let's boil it all down to the absolute must-know facts. This is your final briefing, designed to make sure you can handle any question they decide to throw at you.
This is it, your final checklist. If you can talk your way through these 5 points, you are in fantastic shape. Know the most severe disease. Know the name for typhus that comes back, Brill-Zinsser. Know the key exceptions like Q fever and rickettsial pox. And crucially, know the universal drug of choice for all of these is doxycycline.
Okay, time to put it all together. Quick question. You see a patient with a rash that started on their palms and soles. What does that immediately tell you? It's the spotted fever group, right? And what's the #1 vector for almost every disease in that group? The tick. See? That's how you connect the dots from the clinic straight to the vector.
And there you have it. You've just systematically broken down one of the trickiest topics in all of microbiology. You've got the framework, you've got the mnemonics, and you've got the high-yield facts. Look, the difference between a good score and a great one is mastering these very details. You now have what it takes to master rickettsia.